Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,214 new cases of COVID-19. This brings our statewide total to 43,264 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 2,519 of our total cases are now in healthcare workers. Approximately 7,360 of our total cases are associated with 452 long-term care living facilities, which include nursing homes and personal care homes. Tragically, we now have 1,716 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. As of noon today, hospitals are reporting that approximately 2,777 patients are currently hospitalized due to COVID-19. 611 of those that are hospitalized have required the use of a ventilator or a breathing machine. Across our healthcare system, approximately 47% of hospital beds, 40% of intensive care unit beds, and nearly 70% of our ventilators are still available. We know that staying home has been very difficult for Pennsylvanians. But one area of particular concern are Pennsylvanians suffering from domestic violence and child abuse. Life has changed, but we all still must look out for members of our community who may be in danger at home, including children. If you suspect something is wrong with a neighbor, a family member, a student, client, or someone you see at the grocery store, please say something. Signs of potential abuse and neglect include numerous unexplained injuries and bruises, chronic anxiety, and frequent expressed feelings of inadequacy, poor impulse control, and demonstrating abusive behavior or talk. There is help, and you are not alone. If you see or suspect a child is being abused, call the Department of Human Services Childline at 1-800-932-0313. Again, Childline at 1-800-932-0313. If you are experiencing domestic violence and need help, call the Pennsylvania Coalition Against Domestic Violence at 1-833-727-2335. Again, 1-833-727-2335. And of course, if your life is in immediate danger, please call 911. These past weeks have been very difficult on families who are trying to cope with so many challenges, from children being out of school to working from home or being laid off. As we try to protect our physical health, our mental health has taken a toll. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the Crisis Text Line by texting PA to 741-741. Or call the statewide Support and Referral Helpline at 1-855-284-2494. Again, 1-855-284-2494. We will all get through this together. And now here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you are going to come into contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we can and will recover together. If you have questions about your health, please contact your healthcare provider. And for the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm very pleased to answer questions.
Thank you, Secretary. From WKOK, Senator Yaw was on our station recently, and he's still saying this is no worse than the flu and that the healthy shouldn't be quarantined. What's your response to still hearing this observation?
Well, I know Senator Yaw well, and we have collaborated together on a number of different issues, particularly the opioid crisis. But in this case, I must disagree. COVID-19 is very different than the seasonal influenza that we see every year. This is a global pandemic. There have been over 3 million cases of COVID-19 in the world. We're approaching 1 million cases in the United States, and there have been well over 50,000 deaths in the United States. This is very different. This is much more contagious than the flu, and it's more lethal than the flu. And so I think that COVID-19 continues to pose a significant public health threat to the United States and to Pennsylvania. And the standard of care is that if someone has COVID-19, that they would be isolated. And if they are close contact of someone with COVID-19, then they would be quarantined.
From WKOK, when we move to yellow phase, can libraries, hairdressers, nail salons, and pet groomers reopen?
So yes, many stores will be able to reopen. Libraries, we still want, and other businesses, but we still want people to practice social isolation. We still want those businesses to follow the business guidelines about social isolation, and we want people to wear masks.
From the Scranton Times-Tribune, several times yesterday, Secretary, you warned against overemphasizing the 50 case per 100,000 metric. But can you see a scenario where a county or region fails to reach that threshold and still gets to go into the yellow phase?
I think that would be unlikely. So we're still looking at our data. We'll be looking until the end of the week when we make some announcements for the counties and regions that go from red to yellow on May 8th. I think it would be unlikely that a county doesn't meet that threshold but still is allowed to reopen.
From WNEP, a viewer wants to know if she lives in a county or region that remains closed due to COVID-19. Will she be permitted to travel to the county region where she is employed if it opens before her county of region of residence?
Oh, yes. So there is no limitation of travel in Pennsylvania and no limitation of travel between states. That's part of the living in a democracy of the United States, and there's no limitation of travel whatsoever.
From NBC 10, local coroners say many of the coroners across the state are being left out of the COVID-19 death reporting and want to know how they can be sure that the numbers of fatalities are accurate.
You know, any situation that is moving as quickly, day by day, as COVID-19 poses challenges in terms of collecting our data and reconciling our data. And we have discussed that before. We respect the coroners very much, and we're looking forward to networking with them even further. And so we actually have a phone call with the Coroners Association, with the Executive Director and the President of the Coroners Association, and that is scheduled for Friday.
From CNHI, What can you say to reassure the public that the state's death toll is close to comprehensive and accurate?
Well, I think that we've been doing actually a very good job collecting the data in terms of deaths from many different sources. So this is using our NED system. We've said before that we were in the process of getting a new information system that would be more automated, but had to put that aside when COVID-19 hit. We collect data from hospitals. We collect data from nursing homes and other long-term care living facilities, from our other county and municipal health department partners, and from the coroners. So again, collecting all that and reconciling it is a challenge, especially since it's on a day-to-day basis. But overall, our epidemiologists and disease investigators and detectives are doing a great job.
From WTAE, a lawsuit accuses the Department of Health for failing to properly inspect nursing homes during the pandemic, putting residents at risk of infection and subjecting some to experimental procedures without their consent. Has the department virtually halted inspections, and if so, why?
So, of course, I cannot comment on any lawsuit, but we are following the CMS, the Center for Medicare and Medicaid Services, recommendations and guidelines in terms of inspections, and then we have put out our own Pennsylvania state guidelines, which are consistent with those, and those are available on our website.
From 6ABC, on 4/15, an order was issued that life-sustaining businesses require employees and customers to wear a mask. We've received calls that this does not apply to operations of the City of Philadelphia. Is it true that for city airports, that means the order does not apply to operations on airport premises, including airport tennis, retail and concession, as well as operations by city employees? And if they are not required to wear masks, why the exemption?
So airports are actually under the regulatory authority of the FAA. And so airports are required to follow those guidelines. But our recommendations for the airports and for all local municipalities, our recommendation is to wear masks. That's different than sort of a requirement. But our strong recommendation, again, is that my mask protects you and your mask protects me, and if we're both wearing masks, we're more protective. But airports are under federal guidance.
From WFMZ, the Department of Health said yesterday that Easton Hospital has promised to stay open through June 30th. Given current hospital utilization rates in the Lehigh Valley, is it necessary that Eastern Hospital remain open now?
I think it's very important that Easton Hospital remain open. So, the Southeast and the Northeast are continuing to see significant rates of COVID-19. They're continuing to see significant rates of hospitalization, and we need all available hospital beds to take care of those patients.
From Lehigh Valley Live, how did the state reach this agreement with Stewart Healthcare in reference to Easton Hospital staying open to June 30th?
I'm not at liberty to talk about the negotiations that led to that.
From the Scranton Times-Tribune, some of our readers are asking, why does my county have to wait to reopen for a county I've never been to and will never visit? What is the answer?
Well, so we're looking at different regions, and we're looking at the counties within those regions. We had put out a map in terms of our healthcare regions, but the governor has said that we're not going to be beholden to any specific map or any specific schema. So we're going to be looking at quantitative factors, and we had talked about the rate of infection in a county, but there are other qualitative factors that will be going into making those decisions by the end of this week.
From Spotlight PA, today saw another big spike in deaths, but the increase didn't include many deaths reported for Philadelphia. In fact, the state's death count for Philly hasn't moved much in the past 5 days. Meanwhile, the county's own count is soaring. Why is the state's data reconciliation process taking so long?
As I mentioned before, it takes a while to reconcile that data and to reconcile the data system that Philadelphia County uses and then our data system, and to make sure that they all match. So we're working on all of that every day.
From the Scranton Times-Tribune and for PBS 39, questions about a spike in Northampton County, that Northampton County spiked more than 7%, but none of the other northeastern counties did. Any idea what happened?
I don't, and so our staff will have to do a deeper dive on that.
From Fox 56, Testing numbers at Mohegan Sun Arena and Wilkes-Barre Township continue to be down. Why do you think that is, and how are we trying to get closer to the 200 per day person max?
So you're correct. We have not had the testing counts at that mass testing site that we expected. And so yesterday on my press briefing, I specifically asked that people who have symptoms consistent with COVID-19, really anyone who has symptoms consistent with COVID-19, come for testing. Previously, we had been prioritizing certain groups of patients, such as healthcare personnel and seniors. That is not necessary. We have plenty of capacity at that site for testing of people, and we really recommend and are asking for people to go to the site to get tested so we can get them the results. And since that's being done at our state laboratory, we'll have results usually within 24 hours.
From Capitol Wire, Governor Wolf earlier today suggested that when doing the reopening process, there might be other regions that could be considered other than the health department's health regions, in addition to county-level factors. Will Pennsylvanians be provided with actual benchmarks that are being used by the administration to determine if a region, county, or industry is allowed to reopen? And will explanations be provided to Pennsylvanians as to what factors the region, county, or industry failed to meet, preventing advancement to the yellow phase of reopening?
So as I previously mentioned, the governor has said a number of times that we're not going to be specifically beholden to the schema in our health regions for the Department of Health. So we're going to be looking at counties within regions of Pennsylvania that meet the quantitative and the qualitative factors, and then we'll be making our decisions, and we'll be very pleased to discuss afterwards why we made those decisions.
From the Butler Eagle, another Tuesday spike in the death toll. Are you attributing this to a lag in reporting again, and is this something we can expect to continue every Tuesday?
It has followed that pattern, is that it tends to be lower on Monday, I think because of a lag of reporting over the weekend, and higher on Tuesday. Hard for me to predict in the future whether that trend will continue, but it certainly has been a pattern.
From PBS 39, what's the best way for the elderly or disabled to get tested? This would be someone who doesn't live in the Northeast counties or in Montgomery County and may not be a patient of a hospital network that's providing tests.
So I think one of the best ways would be to call their physician to talk about getting tested. Physicians can recommend where that test might be done. We have asked, actually, hospitals and health systems to test people even if they're outside of network, and I think that they are complying with that. But also, Rite Aid and now CVS are doing testing, and so your doctor could call in or send in an order for a test to one of those pharmacies. You could get tested there.
Also from PBS 39, does the state have some fundamental difference with the way the county coroner is reporting deaths in Northampton County? Yesterday, the county issued a news release reporting 80 deaths, 72 from Northampton County and 8 from other counties or states. And today, the state reports 55 deaths.
I don't know the specifics in terms of the coroner at Northampton County. One specific difference would be if someone does not live in Northampton County. If they live in a different county, then that death will be attributed to their county of residence. That's the CDC guideline. If they live in another state, say New York or New Jersey, then that case or that death would be attributed to New York or New Jersey. And we have to follow the CDC guidelines in terms of how those cases and deaths are reported.
From the Philadelphia Inquirer, Governor Wolf talked about mental health being a reason for reopening marinas, golf courses, and other outdoor recreation. Are you able to gauge how residents are doing from a mental health standpoint right now? Do you have any hard data or even anecdotal evidence on how isolation is affecting Pennsylvanians' mentality? So, we work really closely with the Department of Human Services and the Office of Mental Health and Substance Abuse Services, and we also work really closely with the Department of Drug and Alcohol programs in terms of individuals' mental health and in terms of substance abuse. That's why I continually, every day, put out the text line and the hotline. So the text line is text PA to 741-741, and the statewide support and referral helpline is 1-855-284
2494. I am sure it's extremely stressful for individuals and families to remain at home under the stay-at-home order. Very challenging, stressful, anxiety-provoking. Some people can get depressed, and we want people to have the ability to reach out.
From the Tribune Review, as parts of the state move into the yellow phase, what guidance is there for life-sustaining operations that work out of an office setting? Should employees continue to telework, or is it safe for employers to mandate that they return to their normal settings?
Well, whenever possible, when businesses are in a county, in a region that goes from red to yellow, whenever possible, we would like them to continue to telework. Again, the best way to protect yourself from COVID-19 is to stay home, and if you can telework, then that would be great. But if businesses do need people to come back to work and to the office, they can do that, and we will ask them to follow the business guidance that has been released. We want people to wear masks. We want people to be 6 feet apart. We, of course, recommend the hand washing and other measures that we talk about every day to try to prevent the spread of COVID-19.
From the Philadelphia Inquirer, in Montgomery County, officials discovered after testing the entire correctional facility that 200 people without any symptoms tested positive, demonstrating the need for mass testing. How close is the state to being able to test all inmates and all nursing home residents?
So I saw that study, and that's very interesting. We do know that individuals can have COVID-19 and have absolutely no symptoms. But it will be very challenging in terms of testing resources to be able to test every inmate in a correctional facility, and then every resident and staff of nursing homes and personal care homes. There are several thousand nursing homes and personal care homes, and we're not able to do that. What we are doing now is expanding testing as wide range as possible of symptomatic people. We do hope in the future that we will have the testing resources to be able to test really almost anybody. The key thing to remember, though, is that a negative test doesn't mean that you're going to stay negative. You could be exposed the next day, or you could have just been exposed and develop symptoms 5 days later. So there would have to be some sort of regular pattern of testing, and we don't have the resources to do that. But we're going to continue to work on it.
Also from the Philadelphia Inquirer, Philadelphia's health commissioner said yesterday that it looks like the city is past the peak of the epidemic. Do you think southeastern Pennsylvania is past the peak?
I think that it is past the peak. We'll see, and the virus determines the timetable. But as we look at the trends in data, and I've emphasized this a number of times now, the trends in data, we look at 3-day averages, we look at 7-day average, we look at 2-week averages, are more important than any one day's results. But looking at those trends, it does seem that we are past the peak. But as we start to reopen, as counties and regions go from red to yellow, we're going to have to be very, very careful that we don't see outbreaks, and that we are able to deal with those very, very quickly to prevent the spread of COVID-19.
From the Philadelphia Inquirer, as the state tries to purchase masks and other PPE and supplies from manufacturers or private sellers, have you encountered issues with price gouging, and have you paid above market prices?
So I don't do that, but there are members in terms of the governor's staff and employees of the Pennsylvania Emergency Management Agency under Director Padfield that have been working on purchasing personal protective equipment, and they've been very careful to avoid any price gouging.
Also from the Philadelphia Inquirer, can you detail specifically what supplies or parts manufacturers in Pennsylvania have committed to making, and how robust a response have you gotten on your website for manufacturers?
I don't have any granular details about that, but I did hear from Secretary Davin that there has been robust participation on that website, but I don't have any granular data.
From WQKY, Penn Highlands Health System is reporting they have 2,500 tests for a 5-hospital system and no nasal or antibody tests. What is the state doing to help rural systems obtain testing?
Well, we are going to work with rural systems to make sure they have the ability to do testing. Right now, we are emphasizing the viral testing. The antibody testing right now has interest from a public health perspective, from a surveillance perspective, because if you have antibodies, that indicates that you have had symptoms, you have had COVID-19. However, we need to know the sensitivity and the specificity of those, how accurate they are, and we also do not know how protective those antibodies are and how long-lived they are. So they are not of individual clinical significance for a patient working with their doctor, but they are of interest mostly from a public health surveillance perspective in terms of exposure to COVID-19.
Also from WQKY, what kind of lead time will you give areas for reopening? For example, if you're planning to open an area on May 8th, will they be told a few days prior so businesses can prepare?
The working plan is that we will be able to make an announcement on Friday, May 1st, for regions and counties to go from red to yellow on May 8th.
From the Altoona Mirror, Governor Wolf today said in his teleconference that he is not wedded to the idea of DOH health districts being the basis for reopening the state. So then what will regions look like if they are not health districts? Will they be chosen based on counties' normal patterns of travel and commerce with their neighboring counties?
I think that there'll be a lot of factors that go into that. I think it's useful to look at the state in terms of regions. We used, for a number of different reasons, our Department of Health regions, but the governor has said a number of different times that we're not going to be wedded to that schema.
From WFMZ, a local health official tells us that the amount of testing is currently so focused on at-risk population that it's inadequate for determining the number of cases per 100,000. Earlier today, the governor said the state hasn't developed a benchmark for adequate testing. Can you talk about what considerations go into developing a benchmark?
Well, we're going to be looking at developing a benchmark number in terms of the number of tests. It's just a number. There'll be a number of statistical and public health measures that we'll be looking at. So as we make our announcement by Friday, we will have a benchmark for testing that we'll be shooting for. It'll be aspirational that we would like to get to this much testing in those areas.
From the Associated Press, what needs to happen before Pennsylvania can legitimately test for COVID-19 on a wide enough scale for the public to have confidence that it is safe to go back to normal?
Well, I think that as we go from red to yellow, which is not green, it's not normal activity, I think the residents of those counties and regions should have confidence that we are and have developed a plan in terms of case investigation and contact tracing. We're putting the final touches in terms of our laboratory plan. We'll be able to put all of that out by Friday as we choose which counties and regions open. And I think that the Commonwealth and the residents do have confidence in the governor and the governor's plans.
From the Beaver County Times, there still seems to be confusion over whether nursing home cases will be taken into account separately from the rest of a county, and if one county's situation will preclude an entire region from progressing in the reopening plan. Can you please clarify the administration's stance?
Sure. I have said this a number of different times, but I want to be very clear. Those long-term care living facilities, such as nursing homes and personal care homes, will be included in the counts for counties. They do in regions. They do reside there. Their staff reside there. They will be included in the county's numbers.
From the Philadelphia Inquirer, regarding the Pennsylvania Supreme Court's order today about court proceedings, if state health officials still have a county in red or yellow status, can and should the court system in that county begin performing additional functions?
Well, the court system is a whole separate branch of government, so we don't control the court system. But I know that the Office of General Counsel does have regular discussions with the courts about public health implications of their activities. I can say that in a red area, our recommendation would be that they continue to keep the courts from having public activities and sessions and hearings, and stay as remote as possible in the red areas.
From WBRE, many residents of northeastern Pennsylvania are asking where they can go to get antibody testing. Is there a statewide list available? And if not, what do you recommend?
We do have a statewide list of testing facilities. I don't think we have a statewide list in terms of the antibody testing. So I'm going to have to check on sort of where that is being done. But I want to emphasize, for an individual patient and working with their doctor, the antibody test, in my opinion, does not, and in the opinion of other public health experts really throughout the country, does not provide useful clinical data. It does not mean that you are immune to COVID-19. It means that you had COVID-19 and have antibodies, but how accurate the test is varies, and we do not know. Again, we do not know how protective those antibodies will be and how long-lived they will be. So until that information is known, then they're of public health use only.
Our last question is from PA Post WITF. If health concerns were the only consideration, do you believe the state should plan to offer in-person voting as usual for the primary? And how should Pennsylvania approach the general election?
Well, I'll actually refer to the governor back in terms of voting. I know that he has discussed this extensively with Secretary Bookvar and the Department of State. So I'm going to refer questions about the election to the governor.
Thank you, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow. Thank you.